Let's go on now to hear from Jamie Innes, who's the product director of Inhealthcare, who's going to talk to us about digital remote management.
Thank you very much. Hi everybody, my name is Jamie Innes and as introduced, I'm the product director in Healthcare, and I'm going to talk to you today about how to scale up digital health technologies to support more patients within the NHS. To start with, I just wanted to briefly introduce Inhealthcare, as many of you may have not heard of the organisation before. We are a provider of digital health solutions across the UK and support over 1 million patients using our digital health platform. This is across 50 NHS trusts in England and regional health boards across Scotland and Northern Ireland. As you can imagine, COVID-19 has had a dramatic impact on the adoption of digital health technologies to support patients across the NHS and really speeded up the process of digitisation, which was already taking place. Almost overnight, the NHS was faced with the challenge of how to support its existing caseloads of patients without face-to-face contact, and digital became the de facto approach to support patients, with large adoption of video conferencing and digital solutions to support healthcare professionals and patients remotely. This resulted in unprecedented demand for our services, and as you can see throughout the past year, we've seen patient numbers increase by over 1 million as remote monitoring has continued to prove its effectiveness in managing patients outside of traditional care settings. In healthcare, we have over 100 different digital health services across a wide range of different clinical specialities and support patients in their own homes, but also in care homes. And it's in care homes where we've seen some of the biggest demand for digital services. It's been mentioned throughout the day that care homes are traditionally areas which were slow on the adoption of digital technologies, and that's been through a myriad of different reasons, mainly because of the funding shortages, but also a workforce that haven't received training on using digital technologies as part of their job. COVID-19 has changed that dramatically, and the most vulnerable individuals residing in care homes, it's become a catalyst for change, with digital and remote technologies becoming the primary way for carers to receive support from healthcare professionals. And that trend is set to continue as we maintain vigilance against new strains of COVID, which could require the introduction of shielding for those individuals most at risk. So remote monitoring for patients is really at its heart very simple, and often it involves patients and healthcare professionals involved in a program of cyclical monitoring, where healthcare professionals, receive notifications as patients fall outside of tailored thresholds or meet certain criteria within their pathway. But whilst this can seem extremely simple, often it's the simplest interventions that can have the biggest benefits to healthcare professionals and patients. But often when considering the use of remote technologies and digital solutions, many organisations can get carried away with this technology and forget about the patient and ultimately what's the problem that they're trying to solve. My advice whenever designing any remote monitoring intervention is to always keep it simple. Ask yourself, are we solving the problem that we started with? And ensure that the solution has patient benefits and provides patients with an advantage when compared to the current alternative. Whether it's reassurance that they're being monitored, avoiding the need for travel, patients need to be at the front and centre of digital transformation so that it's more convenient and easier to access for them when compared to face-to-face services. Now, despite some of the dramatic transformations that we've seen over the past 12 months, there are still many barriers to the adoption of remote monitoring solutions within the NHS. And I wanted to highlight how we can break down some of those barriers to ensure that remote monitoring becomes more widely available to patients. Now, the first topic that I wanted to talk about is inclusivity. So when many people think about remote monitoring and digital solutions, they think of smartphone applications. But many users of NHS services might not have access to that technology or feel comfortable using it to interact and receive important information. According to Ofcom, just under 1 in 5 over 75s use a smartphone, and 13% of adults do not use the internet, and that's a figure that's remained stable since 2014. And that's why digital services need to be inclusive and provide patients with a choice on how they can access that digital service and provide different options with a hybrid approach for face-to-face contact, but also different communication channels. So as a quick example, when we've deployed COVID-19 monitoring solutions across Scotland, we've supported patients with different communication channels using text messages, automated phone calls, online portals and smartphone applications so that everybody can be involved in remote monitoring, and it's not just something that's only available to a few select people with technology. Secondly, I want to talk about integration, and I know it's a common subject which has come across, today, but also has been discussed for many years. And a lot of solutions do neglect this. And what it ends up creating is silos of data, which add to the workload of healthcare professionals. Remote monitoring solutions need to have interoperability built in by default with common standards and legal agreements to enforce sharing of data and willingness to interoperate with other systems to ensure data gets into the hands of healthcare professionals. And that really is where we can learn from other industries. If we look at banking as another industry, they've done some great work with their open banking standards, which have enforced how organizations and suppliers need to allow customers choice and to share data between different providers. And that's not just covered APIs and integration, but also gone into customer experience and operational guidelines that suppliers need to follow when using their services. Whenever we've developed solutions, we've always looked at how we can get data back into the hands of healthcare professionals so that they can have a complete picture of that patient and make that informed judgment. And many of it starts with integrating data back into GP systems, because that's really the gateway into the health system and how data can be shared with other areas. Next, I want to talk a little bit about scalability. Many NHS organisations might develop their own remote monitoring solutions and work with local homegrown companies on doing that. And whilst these local solutions might be great in the short term, they lack long-term investment and economies of scale, and most importantly, sharing best practice across the NHS. Now, by collaborating and consolidating at a regional level, NHS organisations can deploy digital solutions quicker and ensure that they get the best value for money from suppliers. As an example, before Christmas, we worked with Wessex AHSN to introduce the COVID monitoring programme across 7 ICS regions, and that covered a population of 7.5 million people. Now, because they were taking a consistent centralised approach, we were able to deploy across all those areas within 3 weeks, but it was only because everywhere agreed to standardise on that consistent approach rather than going down their own approach of local implementation. Finally, I just want to mention data and analytics. And whilst this is often overlooked, commissions need to ensure that remote monitoring solutions not only capture the data that you need to support evaluations, but also have mechanisms to extract and present this data to NHS teams. And this is so they can use it to track patient journeys and identify that interventions are having a positive impact on a patient's journey, providing cost efficiencies back to the NHS. And whilst this ties into integration, it's ensuring that organisations use consistent data standards. Very simply, that can be using NHS numbers, but also SNOMED clinical coding to ensure that everything is consistent across the healthcare spectrum. So quickly, I just wanted to talk a little bit about what we've learned from COVID. And really, it has revolutionised the digital transformation that the NHS was starting and really kicked it into high gear. It's proven that the barriers to adoption of technology can be removed and that there's ability and willingness within the NHS to dramatically change the way that they operate and deliver services whilst maintaining the great levels of service that we've come to expect. There's lots of lessons that have been learned from commissioners and providers, and really, as things start to open up and we start to adjust to a life outside of lockdowns and return to some normality, it's really important that the NHS continues its journey on this digital transformation and doesn't relapse into old habits of face-to-face activities. Because with the current backlog of appointments and future demands on the horizon, there's never been a better time to focus on delivering digital transformation and remote monitoring.
Thank you very much indeed, Jamie. That was really fascinating and reminding us of the rapid transition that has been made, and also, but keeping in focus the needs of